The COVID-19 Fund Board has released a statement giving a breakdown on the use of funds that were collected towards combating the spread, effects and impact of the COVID-19 pandemic. The board, which received donations worth 3 billion shillings, 2.6 billion shillings in cash and 500 million shillings in form of food, say their work was above board and that it continues to support more than 100 health institutions with provision of personal protective equipment. The statement is in response to Public Accounts Committee queries over the registration of the board as a company.
In a statement released to newsrooms by the COVID-19 Emergency Response Fund Board, the board has set the record straight on the collection of funds that it's used as the country continues to fight the pandemic. According to the board, they received cash and in-kind contributions from well-wishers, corporate bodies, multinational institutions, totaling to 2.6 billion shillings in cash and an equivalent of 500 million shillings, mainly in form of food donations. The board received 1.1 billion shillings from Equity Group Foundation, 250 million shillings from Safaricom, 150 million shillings from KCB, 150 million shillings from APSA, 100 million shillings from Cooperative Bank, and 100 million shillings from NCBA. The board says it did not receive any cash from the Exchequer and that donations from the government agencies were collected as personal donations. The Fund Board says it identified two priority pillars to support with the donation, and this was health and livelihood intervention. On the health pillar, the fund prioritized supporting local manufacturing for building capacity in the spirit of Buy Kenya, Build Kenya. The board procured all PPEs from local manufacturers with the technical support of Kenya Medical Practitioners, Pharmacists and Dentist Union, KMPDU, to drive quality. On livelihoods, the board supported over 100,000 families with stipends and food at the height of the pandemic. The Fund Board states it adopted utmost transparency and good corporate governance by setting up audit, fundraising, livelihood and procurement committees, and that all services offered by those who were involved was on a pro bono basis. The board, which is incorporated as a company limited, by guarantee approved and subjected the full operations and activities of the fund to audit by the Auditor General, who has not raised any concerns or adverse finding with respect to the financial statements, integrity of procedures adopted, transparency of information provided, or the value for money aspects of the fund's operations and chosen interventions. The board concludes by stating that it continues to support COVID-19 related provisions of PPEs to 116 health institutions, faith-based mission hospitals, and county-designated COVID-19 facilities.